Hello, welcome to today's webinar sponsored by 3M Healthcare Academy, creating microaesthetics in direct composite. One simple tool, multiple functions. My name is Jihan Kim. I am the co-director of the BioClear Learning Center and faculty of the BioClear Learning Center. This webinar is sponsored by 3M Oral Care, and the content is created by me. So let's just review some of the learning objectives for today's webinar. So first, we want to review elements of microaesthetics, and then define those elements that contribute most to patient-centered versus doctor-centered outcomes. And by that, I mean elements that have the most aesthetic impact for the typical patient. Next, we want to talk about how we can achieve microaesthetics with one tool, the 3M SoftFlex XT disc, and to discuss the multifunctionality of the disc. We're going to review components of color, stability, and shade selection, and the importance of surface texture to color stability. And then finally, we're going to discuss how specular highlights and non-layered polychromaticity contribute to microaesthetics. So let's start with this case. So on the top photograph, what you see is a preoperative presentation. And the patient had several aesthetic concerns. She did not like the open gingival embrasures. She wanted to brighten the color. She didn't like the jagged, harsh incisal embrasures, and then she had some chipped incisal edges. So how are we going to go from the preoperative presentation to the final postoperative result, which we see on the bottom slide, using a technique of injection overmolding of basically 12 plus teeth to rejuvenate her smile? And then how do we go from the composite placement to the final polish in a predictable, prescriptive, and achievable way for the average skilled clinician? So what we're going to talk about with the SoftFlex XT disc is how it fits into the middle part of our treatment sequence. So between composite placement and the initial gross amputation, and then to finally the final polishing sequence. So the 3M SoftFlex XT disc is actually quite critical to just the middle zone of shaping and creating the initial aesthetics of our restoration. So some of the things that we're going to talk about in this webinar are Chapter 1, Microaesthetics of Anterior Composite Restorations, really delving into defining what some of that is. And then Chapter 2, Stages of the 3M SoftFlex XT disc. And pretty much most of the time what I'm using is the large coarse disc. And then Chapter 3, which is going to be talking about finish, polish, color, and specular highlights. Now, I know that many of you, when you first look at the title, you may have thought that this would be a course about composite layering techniques. And as you can see, this is actually going to be something completely different because we're talking about an injection overmolding technique of composite restorations, but then how to really predictably achieve patient-centered aesthetics, patient-centered outcomes. And I'm hoping that this will be content that will be new and interesting for all of you out there. So Chapter 1, before we talk about specifically microaesthetics, what I want to do is just to review just some of the concepts of aesthetics. So macroaesthetics, let's start with that first. So macroaesthetics, we're talking about the total facial form, just the proportions and the interrelationship of the eyes, nose, and the mouth. So basically just looking for pleasing proportions and symmetry of the face. And so here you see a young female with just nice symmetry, nice proportion. Her the thirds of her face, the top, middle, and bottom thirds of her face are evenly proportioned. She has good symmetry left and right. From there, what we would do is to start thinking about mini aesthetics. And with mini aesthetics, we're now starting to focus in on the smile. So we're looking at the oral and dental gingival aesthetics, looking at smile arc, incisor display, buccal corridors. So we'll look at this photograph here. And so here you see a pleasing smile where the smile zone fills in the buccal corridors nicely. We have a nice flow of the arch. The incisal edges mirror the contour of the lower lip. We have a nice balance of gum tissue and white tooth structure, so nice, what I would call pink and white aesthetics. And then finally, we'll get to microaesthetics. And here we're focusing on the specific attributes of the teeth and the gingival shape. So we're looking at tooth form, tooth contour, looking at the color. We're looking at the contacts between the teeth or the connectors, and then the embrasure spaces. So the incisal embrasures, but also just making sure that we don't have open gingival embrasures, which patients often refer to as black triangles. So here you see nice symmetry between the central incisors, and then as we move around the arch, pretty good symmetry between the lateral incisors and the cuspids. We see nice scalloped incisal edges, nice harmony between the gum tissue and the tooth contacts. No open gingival embrasures. And here what you're looking at, what I have presented here are the connectors, or what we would define as the connectors. So in this middle zone here, the 50%, what we're looking at is that the contact between the two central incisors occupies about 50% the length of the central incisors. The contact between the lateral and central incisor is about 40% the length of the central incisor. And the contact between the lateral and the cuspid is about 30% the length of the lateral incisor. So with this nice progression of the contact lengths as we go from the midline to the distal, we're looking at a nice balance between gingival display, having the papilla fill that contact area, and the tooth being anywhere between, the tooth contact being anywhere between 50%, 40%, 30%. So when we break down the dental microaesthetics and we group them, I've grouped them into two groups. So the top four microaesthetics, the contacts, meaning no undesired negative spaces in the gingival areas, incisal embrasures, so looking for aesthetic negative spaces, meaning that we have nice scalloping of those incisal edges, and then macrotexture. So with macrotexture, I'm looking at more just the surface undulations that highlight the facial lobes of the teeth, and then specular highlights. And we'll talk a little bit more about what specular highlights are, but basically what we're looking at are the reflections off of the teeth, the little sparks of light that shine. The connectors, basically, we just talked about the connectors, the progression of the length of the contacts from 50 to 40 to 30 as we move away from the midline. And then microtexture, which is a lot of clinicians like to mimic the pericymata that you see on natural enamel, the little horizontal grooves, usually in the cervical third to half of the tooth. And then layering for a polychromatic effect. So layering shades for dentin, body, and enamel to really mimic that transition from the underlying tooth structure, the underlying dentin, showing through the translucent enamel. So the top four microaesthetics, I like to define those as being patient-centered. So this is something that patients really notice, that patients really, I think, value. The bottom three aesthetics, I really think that those are more doctor-centered. So those are things that clinicians, because of what we understand about natural tooth anatomy, and because we really want to try and mimic nature, those are things that we, as evidence of our skill and our understanding, really try to emulate. But it may not always have the most aesthetic impact for the patients. It may be something that us as clinicians that we notice and we recognize when a skilled clinician has really gone to a lot of trouble, a lot of effort to really replicate nature, but it's not necessarily something that the average patient will notice or discern. So what I want to do is now compare those patient-centered versus doctor-centered microaesthetic concerns. And so here we have a preoperative photograph on the left, and of course what you see are the chipped incisal ledges on the two central incisors. But really what you see most obviously are the open gingival embrasures. And then there is some slight coloration issue with a little bit of tetracycline staining causing the amber coloration on the cervical third of the tooth. Now, what the patient was really unhappy with was the open gingival embrasures. And those open gingival embrasures are something that I like to call unfamiliar negative space. Patients are, the way that our eye works, we really pick up contrast between black and white versus soft color contrast between pink and white. And so when we see those open areas in areas that they don't normally belong, so in those gingival areas, patients have a lot of connotations that, it's a sign of disease, it's a sign of age, it's a sign of deterioration. And so it's something that really can be emotionally charged for a lot of patients, and that they don't like that. And I think that as clinicians, we don't quite appreciate how negative those open gingival embrasures are for patients. So in the postoperative photograph, you can see on the right here that I was able to close those gingival embrasures, and I did do it mostly by changing the contour of the tooth form to make them more rectangular to fill those gingival embrasures. Now, so as a result, I did close those underside negative spaces, but the ideal contact lengths or the connectors weren't achieved. And so in this slide, what I'm trying to show you is if I wanted to achieve ideal contact lengths or connectors, I would have had to do a combination of changing the tooth form, but then also trying to get that the cervical area of those open embrasures closed with more pink tissue. And as we know, that is an unpredictable and oftentimes a difficult treatment. And so the question is, which concern do the patients consider to be worse? The patients really don't like the open gingival embrasures, those black spaces. And for the patient, even though I didn't achieve the ideal connector lengths or the ideal contact lengths, they were very happy with this aesthetic result. So here I'm just talking about an example of, even though I didn't get the ideal connector lengths that doctors would want, and that doctors might sometimes look at the postoperative photograph and say, well, the tooth form isn't ideal because of the contact lengths, the patient was very happy with the result. So next I want to talk about microtexture versus macrotexture. So on the left slide, or I'm sorry, on the left photograph, what you see is macrotexture on untreated centrals on the 25-year-old. And so these teeth have not been treated, but you can see the light reflecting off of the surface contour, which gives you the perception, or that allows us to perceive what the facial lobes might look like on the tooth. And then on the right photo, what I have is two central incisors of a 75-year-old that have been treated. And I've actually created some subtle undulations on the facial surface of the tooth to mimic some of those, the macrotexture from the facial lobes that would occur naturally. On the next slide, I wanted to compare that macrotexture versus microtexture. So on the left photograph, what you see is the macrotexture that I've created just by doing some subtle surface undulations. And then on the right photograph, what you see is microtexture, which has been created on that central incisor restoration. But you can see that you have to really magnify the central incisor to even appreciate some of that microtexture. And I'll kind of bring my arrow in here to highlight some of those. So you see these vertical striations. You even see some little subtle horizontal striations that were actually intentionally created. So these were not an accident. But, you know, really, which has the greater aesthetic impact? And I'm talking about at a social distance. So you have to think about how you have to really magnify this one tooth in order to appreciate the microtexture. But at a social distance, the patient won't see that. If that microtexture collects stain or biofilm at a social distance, which one is most likely to be visible? So what I'm trying to explain is that microtexture can collect stain over time, and at a social distance, that will then become much more visible at a social distance than the microtexture that's just been created there initially to emulate nature. So now let's talk about specular highlights. So the bright spots of light that reflect off the teeth versus layering. And by layering, I'm talking about polychromatic layering of composites. So on the left side, what we have is a patient that has a fractured central incisor. There's a preoperative photograph on the top, and then on the bottom is a postoperative photograph. So first, the one central incisor was treated, and then the patient actually elected to have the right lateral incisor and then the left central, left lateral, and left cuspid all treated as well with the same technique. And this was done with an injection overmolding technique using one color of composite. And with just the composite that I used here was the 3M Filtech Supreme Ultra Universal Restorative, the A1 body shade. And I really like the body shade for these restorations because they have a really nice blend of opacity and translucency. And so what we're able to achieve is a nice transition of color for blending. On the right side, we have a case that was actually contributed by a friend of mine, Dr. Charlie Regalado. And here you have a patient with 2 fractured incisors. And this case was treated with, you know, a nice result with layering, with a layering technique, first layering in a dentin shade, and then on top of that, a body shade, and then on top of that, an enamel shade. And so, you know, the question is, at a social distance, you know, which one is more impactful? So I think at a social distance, what the patients will really see are the little sparks of like the sparkly teeth, much more than what they'll see. They won't see the layers or the polychromaticity of the tooth. But what they'll see is that, you know, whether or not the tooth, the restorations on the right, whether or not it blends with the rest of the dentition. So whether or not probably more the value is similar or close to the other teeth. And then let's look at those 2 cases at a 4-year post-op for the injection overmolded restorations, and then a 2.5-year post-operative for the layered restorations. And you can see that at 4 years, the monolithic injection overmolded restorations have held up nicely. The color is stable. You still have nice integrity of the restorations. On the layered case, you know, there's a little bit of incisal chipping, which has begun, but you can start to notice a little bit of changes in the value, the color of the restorations. They're a little bit darker, a little bit of lifting here at the cervical area. And then, of course, this just the chipping that we have on the incisal edge. So now I want to move on to talking about how we take an injection overmolded restoration and then quickly and predictably shape that to our final form. So let's talk about the stages of the Softflex XT disc. Now I get this question a lot, which disc do I use? I use the large course disc. The other discs are great, and actually I use those in other areas for different purposes. But for what we're going to be talking about in this webinar, I use the large course disc. So let's look at this sequence where this timeline of our protocol where the SofFlex XT disc fits in. So first there's the composite placement. So the method that I use is an injection over molding technique using one color of composite. And then there's the initial amputation, and here I just do that really quickly with a large coarse diamond. And then there's the sculpting phase, the pre-polish, and then what we call the rockstar polish phase that we'll talk about later very briefly. But what I really want to focus on during this webinar is what I'm doing with the 3M SofFlex XT disc. So this disc is actually helping me in 3 of the 5 phases of this treatment sequence. So during stage 1, stage 1 of the disc, this is actually when the disc is being used as a milling instrument. So this is straight out of the box at its maximum grit and stiffness. I'm using that at the end of the amputation phase and the beginning of the initial shaping phase of the restoration. Stage 2, I'm taking that very same disc that I just pulled out of the box and used as a milling instrument, and now I'm using it as a sculpting instrument. So that disc has now lost some of the grit, the coarse grit, so now it's more of a medium grit, and now the stiffness is actually softened, so now we're at more of a medium stiffness. Stage 3, the final stage of the disc, is now we're using it more as a detailing instrument. So at this point, the grit of the disc has transitioned to a medium fine to a fine grit, and it has maximum flexibility. So again, people ask me, well, why not, if I'm basically wanting a disc that's at different grits, why not just switch and use the other grits of the discs that are available in the SofFlex XT kit? Like I said, those other discs are great for other purposes, but for what I'm doing here, as I use the disc, the grit is becoming more and more fine, but I'm developing flexibility in the disc. And the flexibility is what's important to create contour, to create some roundness in the tooth shapes. So let's talk about why I want to create macro texture with the disc. You know, a lot of people would think, well, that seems counterintuitive because the disc is flat. So, and then I know a lot of clinicians like to create surface contour with a fine diamond or a white stone or a brownie. And the thing about those instruments is that they are all convex shapes. And so if I take a convex shape to the surface, the facial surface of the tooth, yes, it will help me to create some concavity. But what we'll see here is that concavity that's created by those convex instruments can be too deep. And when it's deep, it can be difficult to polish and it can collect biofilm. So if you look at this left photograph, you can see the concavity that's been created likely by a brownie instrument. Okay, so now what I want to do is move on to, I want to actually show you a disking video that really demonstrates how I use the disc from start to finish, from the initial composite placement, and then I've already done the amputation, but how I take it from that amputation phase all the way through the sculpting phase to the pre-polish phase. So basically I have the 1 central incisor over molded and disc back to the 80% point. So I'm going to go ahead and disc the second central incisor so you can see the considerable volume. So the very first place that we start is with the incisal edge when the disc is the coarsest and it's the stiffest. So I'm going to go ahead and bring down that incisal edge of the left central incisor to be even with the right side. So I'm going to use it like a lathe. I'm going to disc back and forth. And I'm looking at making sure that the mandrel is parallel with the midline. Okay, so now that I'm getting level, I'm going to mill back and forth over both teeth to make sure that those incisal edges are the same length. Now you can see that the disc has lost some of the coarseness.
so it's lost a little bit of the abrasiveness, but it's still pretty stiff. So now I'm going to invert it, and I'm going to start working back the facial aspect, just concentrating on the incisal half. Still working at pretty high speed. Okay, so once we're close, you can see that I still have about medium coarse abrasiveness, but I'm starting to build in some flexibility to the disc. So now with the increased flexibility, I can blend in the gingival half with the incisal half. Now that my disc has lost even more abrasiveness and is a little bit more flexible, I'm going to actually bring it in on the palatal. The teeth are naturally trapezoidal in shape. We do want to try to mimic the natural tooth form. Now I'm going to take that same disc still, and I'm going to open up the facial embrasures. I'm going to roll in that facial line angles. So here I have another demo. So basically this arch has been all over molded, and so now that we're at about the 90% point, I'm going to actually build in the aesthetics of the arch as a whole. And so at this point, I'm still taking that same disc, and I'm going to work the arch together. So I'm always working 2 teeth at a time. Now what you'll note as I'm doing this is I'm starting to create some facets, some natural peaks and valleys on the facial aspect of these teeth. And so we're still going to use that same disc. So as the disc becomes less coarse and more flexible, we're going to use it to actually accentuate some of those valleys to build some semblance of mamelon grooves. So here, I have a disc that's pretty flexible. And what I'm going to do is take this at about a 45-degree angle and accentuate those grooves. Now this is at sort of a stalling speed. So then we would be using the same disc to enhance the incisal embrasure spaces. And then we can also use the same disc to accentuate the facial embrasures. Rolling in those line angles to different positions depending on how you want the teeth to present, if you want them to present as being wider or narrower. So here's another model where the nuance, the surface nuance is a little bit more complete. You can see from the incisal edge. So those undulations have been softened. The facial embrasure spaces have been opened up. You can appreciate the incisal embrasures and the palatal embrasures. From the side view, as the teeth roll around, you can see the setting. And then I want to show a difference between, here's the matte finish of a case with the surface undulations, and then here's with that case polished on the other side. I want to show the discs at various phases. So this is a fresh disc at the maximum coarseness and maximum stiffness. Here's a disc at that medium stage where some of the abrasiveness has been removed, but the disc still has some stiffness, about medium stiffness. You can see some of the micro cracks starting to develop on the other side, which is the reason for the increase in the flexibility. And here you see a disc at that really worn medium fine stage. A majority of the abrasiveness has actually been removed. You can see that the disc has lost stiffness to the edges, and it's really quite flexible. So I still keep all of these discs at the different stages. This disc is actually something that I would be using to go back in and do some really refined facial contouring. Again, this disc at the coarsest stage is what I use for doing the initial sculpting and shaping. This disc I'm going to be using to start to develop some of the line angles. And again, finally, this disc is what I'm going to be using to be doing the refined surface nuance and texture.
Okay, so hopefully that gives you a good visual, a good demonstration of how I'm using that one disc from start to finish. So now let's move on to chapter 3, and let's spend a little bit of time talking about finish, polish, color, and specular highlights. And I wanted to define this a little bit more. So the 3-step rockstar polish is something that is foundational to the BioClear method that we teach at the BioClear Learning Center. And step 1 of that 3-step polish technique is we actually take the stage 3 soft flex disc that is now at the maximum flexibility and it has the finest texture. We're using that to really refine the surface texture of the restorations, and it's acting as our pre-polish. And I may be dating myself a little bit here, but those of you that have taken a wood shop class, so you know when you're basically polishing your cutting board, you're going through the different grits of sandpaper, and so now we're at the finest grit of sandpaper before we actually do the final polish. So step 2 of the 3-step rockstar polish, we use the magic mix, which is a mix of different grits of pumice, and that is going to give us the microfine matte polished surface before we actually get our mylar finish. Step 3 is where we take a diamond impregnated rubber polisher and to the tooth, and it gives us that mirror shine, that reflective surface that is really what the rockstar polish is known for. Okay, so I'm going to show you a short video that actually demonstrates the 3-step polishing sequence, just to show you how it's a very simplified polishing technique. We basically, like I said, use the stage 3 soft flex XT disc, and then use the magic mix, and then just move on to a diamond impregnated rubber polisher to finish it off. So hopefully that polishing sequence, you know, you'll see that it's a nice simplification, but it really gives you that mirror shine, which we're known for. Now, what I want to do is, you know, you may ask, well, why is a polish something that we consider foundational to a method? You know, it doesn't seem like something that would be that critical. So I want to spend some time reviewing some of the advantages of the Rockstar polish, which is essentially a mylar finish polish. So with that kind of a mirror finish, what we're getting is reduced biofilm attraction and then increased stain resistance. Now, of course, that is mostly due to the fact that there's lack of surface microtexture on the tooth. We also get color stability and predictable shade selection. I'm going to spend some more time talking about that. And then also specular highlights. Remember that kind of bright, sparkly surface, the light reflectance that we see. And then what I'm going to call non-layered polychromaticity. So I'm going to spend some more time just showing you examples of this as well. So let's go back and review color stability and predictable shade selection first. Just to review some elements of color. So as we know, hue is the color. So, you know, blue, yellow, red, that's the color. Chroma is the saturation or intensity of hue. And then value is the relative lightness or darkness of color on the gray scale. So for example, dark blue is going to be lower on the gray scale than lemon yellow. Now, clinically, what's of importance to us is that because we're working with a narrow, a limited color range, value is actually the most important factor in shade selection. If value is correct, then we can compensate for slight discrepancies in hue and chroma. So the other thing I would say was that value is also highly affected by surface texture. So let's look at this a little bit more closely. So impact of surface texture on value. So on the left here, what you see is a patient that actually came for retreatment of an undersized lateral incisor. So she had direct composite placement or direct composite restoration on that lateral incisor. And you can see just the difference in the value between that tooth and the adjacent teeth. Now, I was just doing this just as for demonstration purposes, but if I lightly abrade the surface of that tooth, you can see how the value really jumps. And now the value is almost, it's actually brighter than the adjacent teeth. So the surface texture basically creates light scattering that increases the perceived value of the tooth. And then with time, what can happen is that with that microtexture, it can stain or self-polish. And so when it stains or self-polishes, it can then diminish in value and create color instability. So I guess one of the things that actually makes me think about this is, I know as an industry in the past generations of composites, you know, we've always known that just because of the porosity of the material, that the color stability hasn't been that great. But I wonder that with the newer generations of composites, if, you know, I know that we still think of composite restorations as having poor color stability compared to porcelain, but I wonder if some of it is actually how we're preparing the surface of the restoration of the composite and whether or not we're actually even selecting the appropriate shade or the appropriate value because we're not thinking of a finished surface in mind when we do the shade selection. And I'll explain this a little bit more here. Here, what I have is a case that's in mid-treatment. So the left central incisor has the Rockstar polish showing the true composite color. The right central still has some microtexture because it's in the pre-polish stage just before I hit it with the diamond impregnated polisher. And so you can see that even at this fine texture, that there is a definite difference in the perceived values. The value of the unpolished restoration is quite a bit higher than the polished restoration. Okay, so let's go ahead and take a look at a video here that shows how I do the shade selection. And, you know, when I do my shade selection, I'm thinking about what my final restoration finish is going to be. So with the Rockstar polish, we get a mylar finish. And so because I know that I'm able to achieve that, I'm going to do my shade selection with that in mind. So what I'm doing here is I'm going ahead and I'm placing a little stream of composite, and then I've actually taken a piece of mylar on top of that, pressed it down, and I've cured it. And so what I've done now is essentially I've created a little swatch of composite that has a mylar finish, which is going to be what my final polish is going to be with the restoration. So I know that a lot of clinicians, you know, what we've always done is we've taken a little swatch of composite, we've placed it on the tooth, we've kind of patty caked it a little bit with an instrument, and then we've cured it. And then, you know, then we'll look at that and then decide if it looks like it's an appropriate shade or not. And probably the biggest worry that people have had is whether or not the teeth are dehydrated, because that's going to, you know, influence our color selection. But in this case, what I'm doing is once I place that little swatch of composite, I actually press it down with mylar to about the appropriate thickness that the final restoration needs to be. And then curing it through the mylar also gives me the final polish that I want, because remember, the surface texture influences the value of the final restoration so much. I actually do my color selection with the mylar finish on that little swatch of color. So let's go ahead and finish up with, move on here actually with specular highlights. So specular highlights, remember I said they're those little sparkly reflections off of the restoration of the tooth. So they're the bright spots of light that appear on a smooth, shiny object when it's illuminated. So the thing that's important about that is that they reflect not necessarily the color of the restoration or the color of the object, but they reflect the color of the light source. So here you can see some clear glass wine glasses, and the light that's reflected is kind of the warm glow of the overhead light. Now, visually in art, the reason why those specular highlights are important is that they give our brain a visual cue for the shape and surface quality of the object. So when we see those little sparkly reflectance of light, it gives us our brain some information that, you know, what we have is a high quality reflective surface. So let's think about that clinically, what that means. So I know a lot of times when in the past I've talked to patients, you know, I've told them the difference between porcelain restorations and direct composite restorations are that when the teeth dry out, the porcelain restorations will still be shiny, whereas the composite restorations will go matte. And, you know, to us, I think that intimated that, you know, it was a lesser quality restoration. So here what we have are some composite bonding on the incisors, and you can see with the teeth dry, you know, we have nice tooth form and, you know, pretty good color, but you can see that the surface is quite matte. So it almost looks like not quite of a finished restoration. You know, it kind of really takes away from the overall sense of quality of the restorations. Here you can look at another case where the chipped incisal edges, the fractured incisal edges were treated. And with these teeth, when they're dried, the enamel reflects back some specular highlights. So you can see the reflectance off the enamel, but the bonding has a matte finish. And this is something that we often told patients, is that the composite bonding is going to look matte. And you can see the junction there. Now, I want to show this case, which is the very first case that I showed at the beginning of the webinar. So if you look at this case, which is dried, and if you look at the specular highlights and the surface quality of these restorations, you can see a lot of light bouncing back. And these restorations, you don't really see a big discrepancy between the quality of the restorations and then the surface quality of the enamel. So it blends in really seamlessly, and they, look like, high quality restorations. So kind of one of our sayings is that specular highlights intimate health and wealth, meaning that you have high quality restorations, and because they're shiny, they look healthy. From the lateral views, you can really appreciate the surface quality of those restorations, and how I'm intimating the facial lobes of the teeth on those anterior restorations. Now, just so you know, the entire mouth, all of the teeth were treated except for 4 bicuspid. So all of the anterior teeth, top and bottom, have been treated with injection overmolding and with the method that we're talking about, with the disking with the Softflex XT disc and then the Rockstar polish. So another case to look at. So this patient came for treatment because you can see she's had some incisal wear and the reverse smile, and she's actually still a fairly young patient. She has open gingival embrasures, gingival margins, or gingival recession exposing the roots. She is unhappy with the translucency, just the loss of enamel volume, which is now showing the underlying tooth color. So she feels like her teeth become gray and dark over time. And then this is the immediate post-operative photograph. And you can see how we close the gingival embrasures, lengthen the teeth to get a more pleasing smile arc, and took care of the coloration issues. And, we have the specular highlights off of the tooth. So I think I really like this photograph, and I want to share this. So this is actually a selfie that the patient took with her cell phone. And she sent this as a thank you for her new smile. And, this is kind of what I mean about thinking about patient-centered outcomes versus doctor-centered outcomes. Now, if you want to criticize this from a doctor-centered outcome, you may think, well, it's, not a polychromatic layered restoration. There's no microtexture on the tooth. But at this social distance, how does this smile look? The patient was extremely happy. And I think that if you look at it from a couple of feet away, I think that the restorations, the quality of the restorations, are quite appropriate. Now what we're going to do is to talk about the last advantage of the Rockstar polish and the Mylar finish that we have listed here, which is what I was calling non-layered polychromaticity. And what do I mean by that? So, we know that we know what we mean when we're talking about developing polychromaticity with a composite layering technique, where you're layering in at least 2 shades of composite, a dentin shade and a body shade, or some people like to do a dentin, body, and enamel shade. Now, what I want to show is a slide which is courtesy of 3M that actually shows, this slide was created to show the relative translucencies of their Filtech Supreme Ultra Restorative Composite. So you can see the translucent shade, which obviously is quite translucent, the dentin shade, which has more opacity. The body shade has a little bit more translucency than the dentin shade, and then the enamel shade has more translucency than that body shade. Now, the shade that I prefer to use majority of the time is actually the body shade, because it has a nice blend of opacity and translucency. So depending on how thick or thin I leave the composite over the underlying tooth structure, it allows me to either block color or allow some of the underlying color to show through. Now, just as an aside, these composite discs that were created to show the translucency, these composite discs are actually pressed between 2 sheets of Mylar to a 1 millimeter thickness. And so for the composite companies, when they have a shade for their composite, it is a Mylar finished composite. So I think that if we really want to know the true color, what the final restoration, what the true color is going to be, that I think using at least the Mylar, flat Mylar trick over the composite is just a really simple, easy thing that, anyone can take away and do, starting today. So talking about non-layer polychromaticity. So in all of these restorations, because they're injection over molded restorations, they are done with one color. I am not layering composites. And here you can see on the left, a black triangle case that was treated. And the patient also wanted to have some of the gingival coloration blocked out. Now, we talked about whether or not I should allow some of the underlying coloration to come through. And what we decided on ultimately was to allow just a tiny bit of the amber coloration to come through, just to provide a little bit of warmth to a relatively high value cool color. So these restorations were overmolded with Filtech Supreme Ultra Universal Restorative Shade B1 body. But by managing the thickness of the composite, I was able to get, probably about 85%, blockage of the underlying coloration, but just allowing a tiny bit of warmth to show through. Actually, and even a little bit more on those cuspids, because cuspids are naturally have a little bit more chroma anyway, just to help with allowing a little bit of a sense of polychromaticity to make these restorations look a little bit more, I guess, natural. So here's another case that I wanted to show. And the goal in this case was not to block color, but it was basically to treat the open gingival embrasures and to treat a little bit of decay that was on the lingual surface of these teeth. And so because we were not changing the adjacent, obviously the adjacent restoration, which is quite dark, there's also a left or a right central incisor that has had a crown. Because we're not able to change the existing porcelain restorations, we weren't looking to change any of the color, but we wanted to have everything blend as well as possible. So here we have that tooth with the BioClear anatomic matrices in place. I have a A102, for those of you that are familiar with BioClear, I have an A102 HD matrix on the mesial and the A103 HD matrix on the distal. So this is how we create our anatomic form into which we injection overmold our composite. And the shade that was selected for this restoration, I believe, was A3. So here you can see the tooth right after the injection overmolding and with the matrices removed. And so again, I want to point out the difference in the value between this middle zone, which did not have the mylar matrix next to it, and then here what we call the mylar zone. So you can see that the value in this middle zone is quite a bit higher than this mylar zone, which is actually the true color of the composite. And then here you can see the finished restoration. Now, keep in mind that this tooth is still has a 360-degree wrap of composite over the entire tooth. So what I've done is I've varied the thickness of the composite on the facial surface to allow a little bit of that translucency to come through on the incisal edge, a little bit of that middle body chroma to come through. And then you can see even some of the hypocalcification coming through on the cervical area. Now, the reason why I use the A3 body, and I talked about this earlier, how I really like the blend of translucency and opacity that I get. Now, because I was treating those black triangle areas, I didn't close it fully because I was trying to maintain some nice tooth form and symmetry. But if I'm going to basically mask a black background, I need to have some opacity. So I think one of the mistakes that a lot of people make when they do these restorations, because they're wanting to have a good transition over for color, I think a lot of times people choose a shade that's too translucent, and so they don't get effective block out of color where they actually want it. But you can see in these interproximal areas where I'm trying to block out the black background in those open gingival embrasures, we got some nice color blockage. But by thinning out the composite on the facial, we got some nice coloration to show through. And so you can see there the before and the after. Basically we did some color correction because all the craze lines have been masked, but still the middle body coloration is allowed to come through, and then just a little hint of the incisal translucency. Okay, so just a quick review of some of the products that we talked about. I know I just briefly touched on the BioClear Matrix system, and then we talked briefly about the Magic Mix, which is part of our Rockstar Polish routine. And, the main focus for this webinar was to talk about that middle zone of our treatment sequence, when we're doing the shaping and sculpting of our restorations. And of course, the star of that is the Softflex XT disc, and my favorite being the large coarse disc. We also use the Softflex finishing strips interproximally at the gingival areas just to make sure we've got really seamless restorations. And then, of course, I really enjoy using the Filtech Supreme Ultra Universal Restorative. That's the body shape. That's my favorite. So let's go ahead and review what hopefully the takeaway is from this webinar, which is, to talk about the microaesthetic elements of composite restorations that are really patient-centered and sustainable, to include basically context, no undesired negative spaces, especially in the gingival areas. Incisal embrasures that are pleasing. So just a nice harmonious scallop. So, and this is kind of what I'm calling the familiar aesthetic negative space zone. And then the macro texture, focusing on just achieving the subtle surface undulations that are polishable, so that we don't have issues with staining and biofilm accumulation. And then, of course, the Rockstar Polish, which is to help with minimizing biofilm and stain accumulation, and then giving us the specular highlights, and then the predictable color, and then the non-layered polychromaticity, just depending on how you manage the thickness of that restoration on the facial aspect. And then the Softflex XT disc, which, as hopefully you were able to appreciate that, with that one tool, which I'm sure a lot of you already have, but using it a different way, it becomes a sculpting instrument for just quickly sculpting the initial tooth form, and then as a milling instrument for shaping the embrasures. And so as it becomes a little bit softer, a little bit more flexible, I'm starting to use it to develop some curvature, some line angles, and then as a detailing instrument for really helping to create more of those surface undulations for the macro texture, and then just refining really that surface texture to for the first step of our Rockstar polish. Anyway, thank you so much for sharing the last 50 minutes or so with me, and I hope that this information is something that is new and hopefully enlightening, and can really give you some pearls to take away in your practice right away. Thank you very much.